My name is Brentley Holden, and this is my informative speech, and here's my audience. Today, my speech is on the ulnar collateral ligament and the process of the surgery that is used when repairing it. One of the controlling factors of life, especially in sports, is the ability to stay healthy. This is not just a problem for athletes, it can happen to anyone. Tommy John surgery, another name for the ulnar collateral surgery, is recommended if your lifestyle or job demands a lot of stress on the elbow or if non-surgical treatments don't relieve your pain. I got that quote from JohnHopkinsMedicine.com. Today I'll be talking about the origin of the surgery, the causes that lead to it, how the surgery is performed, and the process of rehabilitation. The origin of the surgery is a pitcher from the Los Angeles Dodgers in 1974 named Tommy John was actually the first to successfully undergo the surgery and return to play. The causes of the surgery is most commonly overuse, and this is due to just a constant rubbing or just use of the ligament, mainly in throwers. Anyone can get a UCL injury from repetitive stress of the elbow or from trauma, but throwers have the higher risk. I got that from WebMD.com. This surgery is actually somewhat of a quick surgery. The process usually takes somewhere between 60 and 90 minutes. The patient that undergoes the surgery will be placed under anesthesia, and the patient is usually able to return home after the surgery, if not in all cases. The first step in Tommy John is to harvest a graft from another part of the body or from another donor. The tendon is usually taken from one of three places: the palmaris longus tendon from the forearm, the hamstring tendon, or the big toe extension tendon in the foot. The second step of the surgery is to clean out the area where the tendon will be removed and replaced. Sometimes the surgeon will use old pieces of the original tendon to reinforce a new tendon to help ensure strength. And the third and final step is that of attaching the tendon onto the forearm itself, or the arm, not the forearm. This can be done by drilling holes into the two bones that the UCL was originally on, that being the humerus and the ulna. The tendon is then threaded through these holes and then secured by sutures, be it buttons or screws. Rehabilitation process is, of course, the longest part, is the most painstaking part of the entire process. The rehabilitation process is a 3-phase process that depends on the healing rate of the tendon, and this could last anywhere from months to close to a year. The first phase of rehabilitation takes place right after surgery, in which the arm is put into a sling, and the arm is usually placed at either a 60 to a 90 degree angle, and this is just to help keep the arm not straight out or pull tight against your body. During this phase, physical rehab is needed to just try to reduce inflammation and protect the healing tissue, try not to let it re-injure itself or to just continue to swell. During the second phase, the sling can be replaced by a hinged brace that locks the arm into just a specific angle so that the arm doesn't move around at all like it would in a sling. In physical therapy in this stage, the physical therapy is used solely to try to increase the range of motion. Just like during most physical therapy sessions, you just want to try to keep it active and keep it loose. And during the third phase, this phase usually takes place around a month after the surgery. And during this phase, a sling is no longer necessary if the patient believes that it is not needed, if they feel well enough without it. If they continually practice physical therapy, the person could have either close to full or complete range of motion in around 2 or 4 months after the surgery. This is, of course, different with athletes, as they need extended care to ensure that that re-injury is not likely. Baseball players specifically could take anywhere from 6 to 9 months after the surgery to even begin the process of throwing again, and return to play could take anywhere from 9 months to a full year, even longer in some cases. An extra bit extra bit of information, as this is a common misbelief among the baseball community, as baseball players believe that surgery leads to an increase in throwing velocity. This has been proven false, as it is supposed to help you learn to take care of your arm, not help you throw harder. Thank you for attending my speech.